want to shift to something you've talked about that I think is one of the most underreported crises in healthcare. So there are 53 million Americans right now serving as unpaid family caregivers. 53 million. You've said that they're essential, but they're ignored. And you've also said that outcomes depend on them. I mean, why does healthcare pretend that the family caregivers don't exist?
I'm sure you can relate to, anybody listening to this podcast can relate, whether it's your parents, your in-laws, right? You're there interpreting insurance letters, you're navigating the portal, you're clarifying referrals for them, you're helping to be the translator for their insurance, which is so nuanced and confusing. You're their appointment coordinator, you're their medication manager, right? You're their tech support when they need it. I think the system runs on these unpaid caregivers. There's millions of patients, and they're relying on their spouse. They're relying on their adult child. They're relying on their family, a friend, a neighbor who could be their primary caregiver. In my work with Medicare Advantage patients, I think it's very clear that patients with strong caregiver support, they have fewer admissions, better adherence, better preventative screening compliance. Yet we don't measure the caregiver strain, right? When caregivers are burned out, the patient's outcomes are going to decline. So definitely something that I think the environment that we're currently in could really focus on, because it is definitely part of that secret sauce that we're missing.